appreciate the reporting. We'll keep watching this one.
Thanks, Joe. Now, it's the Democrats who seem to be getting fed up with the Obamacare fiasco right now. Tomorrow, the Republican-controlled House will be voting on a bill to allow millions of Americans who've been dropped by their insurance companies to keep their policies if they like them, a promise that came from the White House. This is leaving the White House scrambling, though, to offer their own plan before Democrats choose to break ranks.
Joining us now is Congresswoman Debbie Wasserman Schultz. She's the chairwoman of the DNC. Great to have you with us this morning, Congresswoman.
Great to be with you both. Thank you.
Let's deal with what is on the table, right? Where is the backbone among your party members? Why, with these numbers that you should have expected with your rollout not going well, you should have expected because you've talked about it, you should have expected all these problems, why all this talk of revolt?
Let me just correct the record. One is that the vote tomorrow on the Upton bill in the House of Representatives would go much further than simply allowing people to keep their plan if they like it. What it would do is actually allow new policies to be sold that would allow insurance companies to drop people or deny them coverage for pre-existing conditions, allow insurance companies to charge women double just for being women, allow the annual caps to be removed, to be re-added again where the Obamacare legislation prohibits it. So it would set up two completely different tracks and further undermine the implementation of the Affordable Care Act. Democrats will not revolt tomorrow.
Well, that might be the case that is what the bill does, but still Democrats are threatening in the House of Representatives that they're going to have to vote for the Republican plan because it's going to put them in a bad political position if Democrats don't offer something better. So what's the alternative that you, Democrats, or the White House is going to offer up?
Kate, tomorrow, when that legislation comes on the floor, I'm confident that Democrats are going to stand, as we have in unity, to continue to support fully implementing the Affordable Care Act. We do all believe that we should make sure that folks who like their plan can keep it. I know I'm confident that President Obama and his administration is working diligently to come up with a fix for that problem. But let's also recognize that the people who have faced losing their coverage that they like currently, most of them, the overwhelming majority, are going to be able to go on that website, can now, because of the improvements in the website, shop for coverage that is better in benefits and lower in costs. And if you look at, I'll give you a perfect example, there's a woman in my district, Carolyn Newman, who's a breast cancer survivor. She got a letter from her insurance carrier, Blue Cross, that said that the plan that she had now, which was $1,270 a month, was now, with the new coverage that would be made available to her, would only be $604 a month, saving her $7,000 a year. That is really significant when it comes to someone who wasn't able to get insurance coverage as a breast cancer survivor in the first place.
I get you about that, but
many more stories like that.
You're caught up in the optics, though, right now, right? A lot of reality is perception. And here you have the president. He says, if you like your doctor, if you like your plan, you can keep it. Now,
and the overwhelming majority of Americans are able to do that.
But not everybody.
We're talking about 10 million people. That's not something to sneeze at.
And then it's like, it seems like
we're not sneezing at it.
Right, but it seems like, Congresswoman, you're losing the argument, the narrative, at least on two levels. One, you said you can keep it, and you can't. And the second one is, there may be good reasons that you can't keep your plan that you're not making the arguments for. You're not even defending your own bill. What's going on here?
Well, I'm certainly here defending the implementation of the Affordable Care Act because let's look at what's happened since 2010. Since 2010, millions of young adults can stay on their parents' insurance until they're 26. Annual caps are now a thing of the past so that people don't face medical bankruptcy. And lifetime caps will be a thing of the past beginning on January 1st. Women can get access to life-saving preventative care without a copay or a deductible. And I'll tell you, Chris, as a breast cancer survivor, after I shared my own story publicly, I had so many women who were underinsured come up to me and say, you know, Debbie, I had breast cancer, and I had to choose between the chemo and the radiation because I couldn't afford the copay or the deductible on both. That is the peace of mind that the Affordable Care Act has already brought and will bring to millions more. And with every passing month, we will see millions more people sign up for coverage. Look, let's not discount that 500,000 people have been able to sign up for coverage, and we've had 1 million more go on the website, register, and are now shopping for coverage.
I want to ask you a quick
we are
question
going to
about
have more improvements over time.
Quick question about the politics of it as the chairwoman of the DNC.
Sure.
You told Candy Crowley that Democratic candidates in 2014, they should be and they will run on Obamacare because that will be a centerpiece of their campaigns, and that they should run on Obamacare. Karl Rove just wrote, and he said it before, but he wrote in the Wall Street Journal this morning, that Republicans should pray every night that Democrats take her delusional advice and make Obamacare their campaign's centerpiece. I want you to respond to Karl Rove.
Well, let's look at the contrast. So just last week in Virginia, you had a candidate, Ken Cuccinelli, for governor of Virginia, who essentially staked his campaign on Obamacare and said, you know, if you want Obamacare to be implemented, vote for the other guy, Terry McAuliffe. If you don't, then vote for me. And guess what? Terry McAuliffe will be inaugurated as governor of the state of Virginia in January. And when we have an opportunity with every passing month for people to fully feel the benefits, as they already have been since 2010, and they're contrasting between Republicans who were willing to shut the government down over denying people access to quality, affordable health care, who were willing to jeopardize our economy in the name of throwing obstacles in the path of Americans simply being able to stay healthy, and Democrats who want to focus on creating jobs, getting this economy turned around, investing in education, and ensuring that we never again can take the peace of mind away from people who simply want to be able to get access to quality, affordable health care. You're darn right that our candidates are going to run on the advantage that Obamacare will be going into the 2014 election, because the choice will be very clear.
What I hear you saying is, bring it on, Karl Rove. That's what I hear
darn
from
right.
you.
Darn right.
He's the least of your problems.
We'll be ready.
Congresswoman Debbie Wasserman Schultz, thank you for joining us on New Day.
Thank you both.
Great to see you.
You too.
That's the big issue, though, for them, is can they hold it together?